Hello, everyone. My name is Carly Marin. I am a supervisor at Sharp Reese Daily Population Health for Case Management Services. For the project of translating a clinical practice guideline into a best practice alert, I will be focusing on the 2025 Gold Report, the Global Initiative for COPD. So at Sharp Reese Daily within Population Health, we focus on outpatient case management. And really, the goal of our program is to promote well being and improvement of quality of life for the outpatient population. For the purpose of this PowerPoint and this project, I will be focusing on adult disease management, chronic obstructive pulmonary disease, or COPD. And the reason why I'm focusing on this chronic disease management is because of smoking. And smoking is the most important modifiable risk factor for COPD. A little bit about the 2025 Gold Report. It is a global initiative that has evidence-based strategy for COPD diagnoses, management, and prevention. And proactive providers who invest time and resources really do drive a higher smoking quitting rate. And in the last report that came out for 2025, it was recommended that every patient at every clinic visit has their tobacco status queried and documented. So the best practice alert that I'm going to implement has 3 steps. The overall process has 3 heart stops embedded within. It is all part of what case managers already do. It is just going to make it so that they are able to adequately meet the requirements for this Gold Report update. So the first heart stop will be the social determinants of health wheel completion. If you're familiar with EPIC and Compass Rose, that is where we document our population health information. And this will be required upon the enrollment of any population health program. The second hard stop will be a care plan creation for all inclusionary criteria, ICD-10 codes, and social determinants of health wheel risk level. And then the third hard stop will be the actual documentation of the tobacco status during every outreach within the care plan that the case manager opens up as an encounter. So to go into a little bit of each of these, so this is the first place where the data will trigger, and within again the EPIC Compass Rose social determinants of health. This is an example of one that is already filled out where the smoking, if you can see right here, is yellow, meaning that it's moderate. If it was grayed out, then that would be something that would populate this to appear for the nurse. And so it would say the social determinants wheel is missing smoking, and smoking is unknown. Consider filling out the information. And then it can take the nurse to the smoking assessment or the ability to add it later. And so continuing from that, inclusionary data will be if the social determinants of health is unknown, medium risk, high risk, upon enrollment of Sharp Reese Daily case management services within population health, and then ICD-10 codes related to tobacco and dependence or unknown status. Exclusionary will be if we have already asked the patient and they are low risk and not enrolled in case management services or never a smoker. So this is the second part that we talked about. If the patient is a former or current smoker and they have a medium or high risk level on the social determinants of health wheel, it will alert the nurse that they need to add a care plan for smoking cessation. I did add some bullet points here where the nurse, if they do not add it, or maybe will add it later, it can be related to either the patient not answering the call, the patient declined to answer. Another reason could be they rescinded their consent to case management services, or a phone call was unable to be completed due to unable to reach. And so the third step of this will be that the tobacco status will need to be added and captured during every care plan outreach call within the encounter. The note will be hard stopped so that it cannot be signed without that section of the care plan charted on. So the results will be looked at within a short-term period of 90 days. Where we hope to see an increase in the social determinants of health wheel smoking status completion and the smoking status care plan intervention documented, the compliance of that. The long term, looking at it annually, would be hopefully a reduction in smoking rates and improved patient satisfaction within our program. Potential benefits, of course, would be the Gold Report compliance, meaning that we are using evidence-based practice to manage our patients. Smoking cessation, which would then increase and improve COPD admissions and readmissions, and of course provide patient-centered care. Because if you're talking to patients about smoking cessation and where they are, it's going to keep them more accountable for their actions. Harms, it could increase in documentation delays. If the nurse forgets to ask the patient, they would have to call the patient back to gather that information. It may be an uncomfortable conversation with the patient if the patient declines to talk about their smoking status but still wants to participate in case management services. It may lead to patient dissatisfaction if it's something that they do not want to talk about. Other things to consider would be looking at the ICD-10 codes and make sure that it is a complete picture that we want to capture those patients. Nurse education on discussing smoking with patients, how to make it a pleasant, open conversation, to be able to motivate the patient rather than blaming them if they are smoking. Resources and medication review, as these conversations may spark questions from the patient on if they do decide to have smoking cessation, what are their options to quitting. And then that would mean including the whole clinic team and the whole interdisciplinary care team. And of course, working with our systems analyst, that the best practice alert and hard stops are adequately captured. And that is all I have in regards to creating a best practice alert from the Gold Report for COPD and smoking cessation. Thank you.